for joining us on today's Stepping Up Network call. This is the first Stepping Up Network call that we've ever held, so we're really excited that you have been able to join us. My name is Nastasia Walsh. I'm a program manager at the National Association of Counties. You probably heard my voice on these webinars before, and I'm going to facilitate today's network call. For those of you who this is your very first contact with the initiative, this network call is part of Stepping Up, the national initiative to reduce the number of people with mental illnesses in jails. Stepping Up is the result of a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation, and we receive very generous support from the U.S. Department of Justice and other private sponsors to hold these activities and our other activities through the initiative. So just some really quick logistics. On your screen, you can see the questions box. You can use that box at any time to send in questions about the content that we're covering or questions for our speakers or for me. Or if you're having any technical difficulties, in which case we'll respond to you privately to help resolve any of that. At the time when it starts to be time for the questions, I'll go ahead and read your questions aloud for you and have everybody respond to them that way. So please feel free to submit questions now or at any time throughout the webinar. Since this is our first Stepping Up Network call, I want to take a minute to introduce you to the staff at the 3 Stepping Up partner organizations who work on this initiative every single day and are here to support you through all of your efforts. So first, as you can see on the slide, these are the folks from the National Association of Counties who work on Stepping Up on the day-to-day. We have Megan Gilmore, who's the Program Director for Health, Human Services, and Justice, as well as myself, Nastasia. And then we also work with Kathy Rowings, Dr. Natalie Ortiz, and Olivia Ned, who are all part of our Justice Program staff, and you've probably heard from them on other webinars and activities as well. And then Hadi Sadai and Bryden Bowden are our legislative staff who work on justice and public safety and the health policy steering committees, respectively, at NACO, and so they're the ones who are working with the federal officials and the administration on these issues. Just really quickly, for those of you who are not familiar with NACO, the National Association of Counties represents the country's 3,069 counties, and we really bring county officials together to advocate with a collective voice on national policies, exchange ideas, implement innovative practices in counties, and really enhance the public's understanding of what county governments do. Since we know that counties run about 91% of the country's jails and spend billions of dollars on criminal justice and health every year, NACO is part of Stepping Up because we know that counties are really on the front lines of this issue, and this is such an important issue for our members, the county officials. So we're very excited to be part of Stepping Up and these efforts. The next partner that I want to introduce is the American Psychiatric Association Foundation. So I'm going to let Dan Gillison, who is the Executive Director of the Foundation, introduce his staff working on Stepping Up. Dan, are you on the phone?
Yes, Nastasia, good afternoon. I am I'm happy to be here with you and with your audience. And I want to first say hello to everyone that's on the call, and also I want to say hello to our partners, NACO, National Association of Counties, as well as the Council for State Governments. Kudos to the NACO staff who are doing this webinar because they're coming right out of their National Legislative Conference that just wrapped up. So, and there's a lot of work that goes on the front end of that. So for them to do this on the heels of that legislative conference, it's really a compliment to their work. I want to thank everybody for taking the time out of the day to participate in this webinar. As Nastasia indicated, my name is Dan Gillison. I'm the Executive Director for the American Psychiatric Association Foundation, and previously was with NACO, and absolutely understand what all of you all do, and personally understand that the rubber hits the road in the counties, and I want to say thank you for what you do. I became the Executive Director of the association in July of 2016 and of the foundation, and I'm very fortunate to have been able to see the crisis affecting the taxpayer dollars in local counties such as yourselves, and how it affects those we hold close to us now in terms of the family, friends, and the others living in the community. So I've now seen both sides of it, the financial side and now the personal side from the mental illness and what it does to communities. Incarcerating the mentally ill is just not okay, and the American Psychiatric Association Foundation is proud to be participating in the Stepping Up initiative, as well as encouraging the APA's members to embrace this crisis at the local level in which they live, essentially by lending their psychiatric expertise. As my predecessor coined the phrase, it's not a moment, it's a movement. We're trying to carry on that work. We're into year 2 of the partnership and very excited to see where we're going and appreciate the opportunity to participate in this network call with you. Thanks, Nastasia.
Great. Thank you so much, Dan. We're so excited to have you on the line and to obviously have APAF as a strong partner on the initiative. So the final partner is the Council of State Governments Justice Center, and I'm going to let Katie Habert, who's the Deputy Director of the Justice Center's Behavioral Health Program, introduce the Justice Center staff who works on stepping up. So Katie?
Great. Thanks, Nastasia. Good afternoon, everybody, and thanks so much for joining this call. As Nastasia mentioned, my name is Katie Habert, and I'm a Deputy Program Director at the Council of State Governments Justice Center. And we at the Justice Center remain very, very excited to be a part of this initiative and to be partnering with NACO and APAF. Just very briefly about the Justice Center for those that may not be as familiar. We are a nonprofit organization that provides research-driven strategies and tools to really help increase public safety and strengthen communities. We work closely with the Department of Justice, Bureau of Justice Assistance, and others as a technical assistance provider for Second Chance Act grantees, Justice and Mental Health Collaboration grantees, as well as Justice Reinvestment, among other projects. And through a lot of this work, we've just been really privileged to work with counties and states across the U.S. for more than a decade and have just been amazed at all of the innovation going on, in particular at the county level. And similar to APAF and NACO, we often hear on the ground how committed people are to reducing the number of people with mental illnesses and co-occurring substance use disorders in jails. And in partnering with APAF, NACO, BJA, and others, we really hope to emphasize through Stepping Up a paradigm shift from a focus on pilots and programs to a focus on systems-level, data-driven strategies that really lead to measurable reductions. And so, as Nastasia mentioned, these webinars and network calls are opportunities to discuss those strategies and learn from one another and spread innovation. And we're just thrilled to be a part of it and to learn from all the great work that you all are doing. We do have a team as well at the Justice Center that is thrilled to support Stepping Up. As I mentioned, we have myself who works on this initiative, as well as Dr. Richard Cho, a few senior policy advisors, Hallie Fadertoe and Risa Hanneberg. We also benefit from the expertise of Dr. Fred Osher, as well as senior fellow and senior policy analysts Deanna Adams, Shanice Bonilla, and Will Englehart, who you will hear from in just a few minutes. And so we really thank you all for being a part of this and allowing us to be a part of this initiative as well. Nastasia?
Great. Thank you so much, Katie. And you know, we're really excited. The three partners, I think, really bring a lot of different perspectives and ideas, and really we hope that everybody on the phone feels that they can reach out to any of us on any of the staff to assist you with your Stepping Up efforts, and I'll have contact information for the three different organizations that's on the very last slide at the end of the network call. So I hope folks will be encouraged to reach out to us and see how we can help you along. So we are really excited because we had more than 250 people register for this network call, which is amazing. And so we're really encouraged by your engagement of the Stepping Up counties and your interest in being a part of this. But unfortunately, what that does mean is that we're not able to have everyone on the call introduce themselves and go around the room. As you can imagine, that would probably take up the rest of the time of the phone call. And so what I'd like to do just is to get a better idea of who's on the phone, and so you all know who's on the phone and who's part of this network, I'm going to do some polling questions with you. So why don't we go ahead and launch the first poll, and you'll see something pop up on your screen. Great. Why don't we go ahead and show the results? So we've got, let's see, 8% are county elected officials, almost a third of you from the Health and Human Services folks, and about 10% law enforcement and a few state officials. For those of you who are in the other category, if you wouldn't mind just including in the questions box, just list, where you fit in. We're only allowed to have 5 choices on here, but we're still very curious about who is on the line. So please feel free to send that into the questions box. We'd love to hear who you are. Why don't we launch poll number 2 and see where people are calling in from? Great. Why don't we show the results? So a pretty good mix of folks. So we've got, folks all over the country, Northeast, South, a lot of folks out in the West, it looks like, and about a quarter of you sort of from the middle of the country. So thank you so much for joining. We know that this is not an East Coast or a West Coast or a Midwest problem. We know that this is a challenge that folks all over the country are facing, so we appreciate that. Why don't we do poll number 3? All right, let's show that one. All right, so really interesting. I mean, this is sort of what we're seeing from folks who are signing up. We're seeing, we've got about a third of you are rural, a third mid-size, and almost a third from the large urban, and a few state folks. So this is great. We've got a good mix of folks, and the Stepping Up initiative is really trying to be responsive to all different sizes and the diversity of counties, and so this is exactly why, because we know that this is something that's important to counties of all sizes. All right, bear with me. We only have 2 more polls. Let's launch poll number 4. All right, let's see this next one. All right, so about 60% of you have passed a resolution. Thank you so much. And we've got some other folks working on it and some folks who are unsure. So for those of you who aren't sure, please feel free to go to the Stepping Up website, stepuptogether.org/what you can do. If you can get to it straight from the homepage, stepuptogether.org, and you can see if your county is listed under that map there and see if you're part of the initiative. And there's also a place there where you can download a copy of the resolution template and share it with your board if you haven't joined us. So thank you for that. All right, final poll. Let's do this. Okay, that looks like just about everybody, so let's see. All right, so we're about half and half of the folks who were on the previous webinar. We want to make sure that folks know that webinar is recorded. It's available up on the NACO website. You go to naco.org/webinars. You can get the PowerPoint slides and listen to the recording as well, and so we'd love to have you go on there. This call is not going to be a repeat of that. We're going to dive a lot deeper with some of the counties that were involved there on a similar topic, but want to make sure everybody can go back and review that after this. So thank you so much for bearing with me on all of the polling. I just think it's good to know who's on the phone with us, and so you know, too, who's part of your network. So I want to give a quick update on Stepping Up and where we are at as we start to approach the 2-year anniversary of the initiative, which will be this May. I'm proud to announce that as of today, we have 339 counties across the country that have already signed on by passing a resolution to start their own initiatives and work towards reducing mental illness in jail. So we really, really appreciate the support. The most recent resolution came from Potter County in Pennsylvania. Potter County has a population of around 18,000 people, and we're very, very excited to have them and all of you join the initiative as well. The counties represented in these 339 counties, we represent 123 million people across 42 states throughout the country, so it's about 38% of the U.S. population. Which is, obviously a lot of people, and we're seeing a lot of folks who are very interested in this. And as you saw, sort of when we're even looking at this webinar, about 45%, almost half of the counties who have joined the initiative have fewer than 100,000 people in their population. And so we know this is something that's impacting our rural counties in addition to some of our more urban counties as well. And like I said, you can go to the website, stepuptogether.org. If you don't see your name and you think it should be on there, feel free to reach out to us with the resolution. We'll make sure that we include you on there. So 2017 has been a very busy year for the initiative already. In January, California held a Stepping Up Summit that brought in teams from behavioral health, law enforcement, the courts, probation, and county officials. To a 2-day meeting. There were 53 of the state's 58 counties were represented at that meeting, and so we have video recordings up on the Stepping Up website. Just go to stepuptogether.org and look under the events tab, and you can see video recordings from that 400-person summit and get some tips and some ideas there. The Stepping Up partners have also given presentations on the initiative in San Antonio, Oregon, Tennessee, and Pennsylvania since the beginning of the year. We also conducted a seminar on Stepping Up at the National Sheriff's Association's Winter Legislative Conference, and we are invited back to do another one at their annual conference in Reno in June. We'll also be speaking at the National Council on Behavioral Health Conference in April in Seattle, if any of you are headed to that. And then, as Dan mentioned too, at NACO's legislative conference this past week, we held 2 different workshops related to tips for reducing mental illness in your jails. One was on strategies for reinvesting justice dollars into mental health, and one was focused on data and information sharing. So the recordings for those 2 workshops should be available within the next week or so up on NACO's Conference Learning Center website, and anybody is welcome to go listen in on those and view the recordings of those. So you can see Stepping Up has had a lot of activity, and we know that there's a lot more coming down the pike, and we know that there's a lot going on in your counties and in your states as well, and we're excited to be a part of those too. As many of you know, in 2017, we at Stepping Up are launching a new series of webinars, these network calls, conference workshops. We'll be doing some peer exchanges, small group networking, and other peer learning activities for the Stepping Up counties. These monthly webinars and networking calls are really going to be sort of the place to get the latest research and strategies for creating innovative policies, programs in your counties to reduce the number of people with mental illnesses in your jails. And so we know that, for folks on the phone, everybody is welcome to join these webinars and network calls, and we encourage you to do that and share them with your peers. The next webinar is going to be on April 6th at 2 o'clock Eastern Time, and we'll cover question 2 of the 6 questions document, which is really going to focus on screening and assessment for mental health and substance use disorders in the jail. The quarterly small group network calls are smaller groups of rural, mid-sized, and large urban counties who are involved in the initiative already as a way to have smaller group peer networking. So if your county has passed a resolution, you should have received an email maybe 2 weeks ago with an invitation to join one or all of these small group networks. They're starting next week. And so if you got that email, please be sure to respond, and we're going to send another email out either later today or tomorrow as a reminder for that. So please respond to that so we can include you on those network calls. Again, those are invitation only to the counties who have passed a Stepping Up resolution to be a part of that. So we hope that these will be a great opportunity to do more peer networking, and we really want to hear from you about what you want to discuss on these calls and what would be helpful for you as well. One last update. As you heard on the previous webinar, and since about half of you weren't on the previous webinar, I'm glad we have an opportunity to talk about this. The U.S. Department of Justice's Bureau of Justice Assistance has a solicitation out right now for the Justice and Mental Health Collaboration Program. And so this year's grant solicitation is due on April 4th, so you still have some time to get with your folks and apply. It's broken into these 3 categories, as you can see up on the screen. Category 1 really focuses on a comprehensive county analysis and strategic planning, sort of like the 6 questions process that we heard about on the last webinar and that we're going to talk about a little bit today. Category 2 focuses on law enforcement and encourages law enforcement and mental health partners to take a look at what policies and strategies they have in place and help them sort of come to a conclusion about developing a partnership to further these efforts. And then category 3 focuses on implementation and expansion efforts to divert and meet the needs of people with mental illnesses. This is sort of where you can fund your pilot projects, your demonstration projects with this. So I would strongly encourage folks to check out this grant opportunity, talk to your partners about it. The website is right there on the slide that you can see, and that will take you directly there. You don't have to be a Stepping Up county to qualify for these grants. And then if you do receive these grants, you will receive intensive technical assistance to implement the different categories of things that you're doing. So a great opportunity for those who are working on this issue. So as the Stepping Up partners, NACO, the CSG Justice Center, and the American Psychiatric Association Foundation, as we were developing our plans for how we're going to support you throughout this initiative, throughout this year and beyond, we sort of recognized that one of the things that many of you had been asking for is an opportunity to hear from each other. The #1 question that I get from Stepping Up counties is to help you identify or connect you with other counties who are doing similar work to what you're interested in doing or similarly situated. And so one of the main purposes of the network calls is really to provide an opportunity for you, the participants, to connect with the speakers from the different counties across the country who are doing innovative and interesting work on the topics that you're doing. So webinars are a great way of sort of getting information out there in a short period of time, but we are usually scrambling for time at the end and don't have as much for Q&A as I think we would like to have. So these network calls will always follow the webinars and feature some of the same speakers so you can follow up with them on the things that you were hoping to know more about from those previous conversations. The other purpose is to have a venue to share information about what's happening around the country with the initiative and share any opportunities that are coming up, like that JMHEP grant and any conferences that are coming up that you all might be interested in that are related. You all make the initiative, and we want to make sure that you feel like you are a part of it and you have an opportunity to be heard and hear from your peers. And we'll do some polling at the very, very end to hear a little bit more about what you're hoping to get out of these networks, and we'll have an evaluation survey too, because we want to make sure that these are things that are responsive to your needs and that are looking at your ideas as well. So you feel free to send out the do the evaluation and fill out the polling questions, or you can also always email or call any of the staff that we introduce at the beginning of the call. And like I said, I'll include our contact information. So if you don't want to do the evaluation, we're always here and we want to hear from you and what you're doing. So thank you so much for being part of our first call and part of the growing network of 339 Stepping Up counties. So what I want to do is switch gears and briefly introduce our speakers for the network call, and then I'll pass it over to them to give a brief introduction of themselves and a quick recap of their presentation if they were on here during the last call. So first we have Will Engelhardt, who is filling in for Risa Hannenberg today. Will is a senior policy analyst in the Behavioral Health Program at the Council of State Governments Justice Center. He provides technical assistance to jurisdictions across the country on the 6 questions framework and helps guide them on reducing the number of people with behavioral health disorders in the justice system. Next is the Honorable Roy Charles Brooks. He's a county commissioner from Tarrant County, Texas, and the first vice president of the National Association of Counties. You heard from him on the last webinar. And then finally, we have Sarah Benedict. And Sarah is the criminal justice coordinator for Dunn County, Wisconsin, for their Criminal Justice Collaboration Division and their Criminal Justice Coordinating Council. Sarah and the folks in Dunn County have been very involved in stepping up and been working on this issue since the initiative started. So we're really excited to have all 3 of these speakers here today. So to kick off the discussion, I'm going to have each of the speakers spend no more than 5 minutes summarizing the work they're doing in their county or nationally with a focus on question 1 of the 6 questions document, which is your leadership committed? And so as they're speaking, please feel free to start submitting those questions to help kick off the discussion after each one of them is done. And again, just go to the questions box and type in your questions, and we'll be able to have the speakers respond to those. So Will, why don't you start?
Thanks so much, Nastasia, and good afternoon to everybody, and thank you for having me. As Nastasia mentioned, my name is Will Engelhardt. I'm a senior policy analyst with the Council of State Governments Justice Center. And I provide technical assistance to counties around the country, primarily counties that have received funding for this year and last year through the Justice and Mental Health Collaboration Program grant track that Nastasia actually mentioned previously, focusing on the same goal of developing a system-wide plan to reduce the prevalence of mental illness in jails, and then also provide some more intensive technical assistance to counties where we actually go to them and help collect data from them ourselves, analyze the data that's available in the county, and present findings and a series of recommendations to those counties and to the leaders there on ways to improve responses to people with mental illnesses in their jail. So as we get to the question and answer period, maybe I can be helpful in terms of talking about different activities and planning practices that we're seeing counties across the country engage in around this issue. For the time being, I'm just going to try to very quickly review the 6 questions document, as that's the foundational document for the Stepping Up initiative on methods that we're recommending that counties take to try to address this issue in their jurisdiction. And as Nastasia mentioned, there's a much more detailed webinar available from February 22nd on their website, and also the 6-question document itself, 6-question county leaders can ask to reduce the prevalence of mental illness in their jails, available on the stepuptogether.org website. So very quickly, the 6 questions we're asking counties to think about when addressing this issue is: 1, is your leadership committed? 2, if your leadership is committed, do you have timely screening and assessment for mental illness, co-occurring substance use disorders, and criminogenic risk available at your jail? 3, are you collecting baseline data? 4, if you have that in place, have you conducted a comprehensive process analysis and service inventory of your system? 5, have you prioritized policy, practice, and funding? And then finally, do you track progress? And the first question about is your leadership committed may seem like a obvious question, but it actually really is the absolutely most important question of all, because unlike at the state level, you do not necessarily have that legislative method to move forward some of the recommendations that you might have. So really having that commitment at the highest level is actually absolutely essential. And once you've hopefully passed a resolution, or your county commissioner has really mandated the importance of addressing this issue, thinking creatively about how to collaborate across agencies, how to form a team, a planning team in place. We've seen many counties that do have these planning teams in place for both criminal justice and behavioral health agencies, but many do not have them in place as well. So how to form that committee, how to have a coordinator who can really move that planning process forward and also relay this information on to senior leadership in the county, and come up with key decisions and key next steps for improving responses to people with mental illnesses in your jail. Is a quite complicated process, but one that really starts with that commitment at the highest level. So following from that question, saying you have committed to this issue and have set up some of those processes in place to reduce the prevalence of mental illness in jails, you have to know how many people with mental illnesses are in jails and come up with a systematic way of identifying people with mental illnesses in jails. So as part of this initiative, we're recommending that counties at their jails implement a validated screening process that typically can be a pretty short 5-minute question, about 8 to 10 questions that can be implemented hopefully at booking into your jail for everyone booked into jail. And for those that screen positive on this screening instrument, would be referred for a follow-up clinical assessment by a mental health professional that could evaluate whether this person is diagnosed with a mental illness. And this would give you a good estimate not only of how many people with mental illnesses are in your jail, but also hopefully help identify the population that are in most need of treatment, both in the community and in the jail itself. So that was like a 1-second review of screening and assessment, but we're going to have a whole other webinar that will really spell that out in a lot more detail coming up, as Nastasia mentioned. So moving past that quickly, the next recommendation is about collecting baseline data, and part of this document we're recommending 4 key measures that every county should be able to track. And first is just that prevalence rate of people with mental illnesses in your jail, that again hopefully would come from that screening and assessment process that we're recommending. Then also, once you've identified that population, understanding the length of stay and the length of average length of stay for people with mental illnesses in your jail. Then how many of those folks are being connected to treatment upon release from jail in the community. And finally, looking at the recidivism rate for people with mental illnesses, how many folks are returning to jail. And the reason we're focusing on those 4 key measures, and we found counties have found these 4 measures very useful, concise measures to follow up on, is because nationally we're seeing a much higher rate of people with mental illnesses booked into jail. We're seeing them stay typically about twice as long in jail for a variety of reasons in comparison to people without mental illnesses. Upon release, especially people with co-occurring disorders, nationally have pretty low rates of connection to care. And finally, we're seeing people with mental illnesses return to jail at a higher rate. So if you're able to track those measures and set that baseline of where those are, hopefully as you think about addressing gaps in your system, you can work to see if you can reduce some of those measures or adjust some of those measures appropriately. Along with that data collection process, we're recommending that counties look at how people move through the system and flow through the system, and also identify available programs and practices that already exist in the system. And as we often say, when you've been to one county, you've been to one county. So every county is different, every county is extremely complicated, and again, it may seem obvious to folks that are working in the county, but just understanding all of the different programs and practices that are available to people within the system, whether that's through a sequential intercept mapping process or another inventory of services process, is highly, highly useful just for this planning purposes. And then also understanding, as a person with mental illness is entering into the criminal justice system, what are the different options that are available to them as they move through the system. So where are options for diversion? Where can information be shared? Are there clear areas where there are roadblocks for people moving through the system, or places where people are being hung up? And we're seeing a lot of jurisdictions as they go through this process and have conversations between the behavioral health and criminal justice agencies, are identifying some pretty low-hanging fruit to just improve the way that the system operates. So definitely something that we're recommending. And then once you've done the process of identifying those 4 key measures of the data we've talked about and looking at how your system operates, hopefully that will provide you with a pretty significant amount of information about where the gaps are in your system and where there are areas for improvement. And that's where we'd go to that 5th question of prioritizing policy, practice, and funding. And from that process of looking at data and looking qualitatively at how your system functions, you could hopefully come away with some pretty clear findings and recommendations for improving policies that are in place. And that's where you would want to go back to your county commissioners to think about funding opportunities at the county level. Are there funding opportunities at the state level? And a good example today of what Nastasia mentioned, funding opportunities at the federal level that can address some of these gaps, and hopefully the data that you've collected can show the reason for why you need to address these gaps and what types of practices you would want to implement there. And then once you've gone through actually implementing some changes and implementing some practices, you want to track the progress that you're making around that. And so, for example, if you've implemented a new police diversion program, you'd want to see if you're having an impact on the number of people with mental illnesses booked into jail. Or if you've implemented a new pretrial release program, you'd want to see if you've had an impact on that average length of stay for people with mental illnesses booked into jail. So we're really advocating that counties are able to track in real time those 4 key measures of prevalence of people with mental illnesses in jail, their average length of stay, connection to care, and recidivism rates, and that's something that they can see if they're having the impact that they hope to have. So I flew through that pretty quickly, but maybe a little over my 5 minutes, so I apologize, but I'm going to pass it off to Commissioner Brooks and to Ms. Benedict to talk a little bit more about their jurisdictions, how they work on that leadership piece and build support around this initiative.
Great, thank you, Will. And for those, we had a couple of questions about the slides. We didn't have a slide on the 6 questions that Will just quickly went through. If you want to look at that February 2nd webinar, Risa goes through those 6 questions in much more detail, and all of the webinars going forward are going to focus on on each of those 6 questions, and you can also get a copy of that report on the website stepuptogether.org. So why don't I turn it over to Commissioner Brooks?
Good afternoon, and thank you to all of you who are on this call today. I want to especially say hello to my colleagues from NACO, who I just left yesterday, to Dan Gillison at the American Psychological Association Foundation. Dan is a dear friend and a dear fraternity brother, and I haven't seen him since he left NACO. So hey, Dan, I'm glad to see where you are now, and we'll be reaching out. And for my friends at the Council of State Governments Justice Center, hi. I'm going to focus primarily on what we've done in Tarrant County and talk a little bit about how you generate leadership for your program and how you use that leadership to sustain the program. Let me tell you what we've done in Tarrant County. We came together over this issue of addressing mentally ill persons in our county jail, particularly the over-incarceration of mentally ill persons in our county jail. We came to this issue, came together on this issue through trying to apply for a MacArthur Foundation grant to address these very things, and I'm sure that many of you on this call applied for that very same grant. We in Tarrant County were not successful in obtaining the grant, but through that process, through the process of putting together that application, we discovered that we had enough community resources available to us in Tarrant County to address these issues on our own. The first thing we did was to empower our Criminal Justice Coordinating Council, which already existed, to be the project leader for this initiative. Our Criminal Justice Coordinating Council is appointed by our County Board of Commissioners. It includes persons from just about every department in the county that touches criminal justice, from the judges to the prosecutors to the probation officers, to people in the community. The Defense Bar is represented on our Criminal Justice Coordinating Committee, as is the Sheriff's Department, and several local police jurisdictions from our largest police agencies. What we did next was to enter into a partnership with Tarleton State University, which has a major facility located in our county, to study our jail and to determine who's there, why are they there, how long have they been there, and how many of them were mentally ill. We received the results of their study this past fall, and it made several recommendations to us. Their recommendations pretty well track the 5 questions the 5 questions that are the subject of this discussion. Particularly, they suggested that we needed an aggressive screening and assessment tool, that we needed to track they put together a baseline data study for us. They recommended a means of tracking that data as we went forward. They recommended that we use the assessment tool as a diversion tool to make sure that those who were seriously mentally ill were diverted to a setting other than our county jail where they could get the appropriate supervision and treatment. And they recommended that we track our progress. Now, many of you have criminal justice coordinating councils in your counties. We found this to be just the perfect organization to lead this initiative. They are backed up by our commissioners, Board of Commissioners. The leadership on that body in terms of this particular issue comes from me. Let's see what else. Our Criminal Justice Coordinating Council is responsible for developing policy and making recommendations to Commissioners Court on how we go forward in changing the justice paradigm in our county such that mentally ill persons are no longer over-incarcerated in our jail. In terms of sustainability, we feel like we will save an awful lot of money by housing and treating these individuals in a lower setting than our county jail, and that we can use those savings to reinvest in our justice system so that this program is thereby sustainable. That's where we are in Tarrant County. I will look forward to answering your questions over the course of the remainder of this webinar.
Great. Thanks so much, Commissioner. Sarah?
Hi, this is Sarah Benedict with Dunn County. Can you hear me okay?
Yes, we can. Thank you.
Great. Well, thank you for inviting me to be a panelist and participate on this call. Appreciate everyone out there listening. This is, everyone's time is very valuable, and it's just great to have such a large audience out there. I'm here to talk about the Stepping Up efforts in Dunn County, Wisconsin. So we're what we would consider a mid-sized county, very rural, but near 2 metropolitan areas. We're just under 45,000. We have a university in our town. so often as with small counties, it's the same individuals that really are the leaders and the practitioners out in the community, and folks wear a lot of different hats. So the perspective I'll be bringing is really from that smaller county and how you can get started with the Stepping Up initiative. So for us, it really was a matter of our leadership being committed. We have an active county board chairman, Steve Rasmussen, and at the time, a county manager, Gene Smith. They're very active in NACO. We find NACO to be a very important organization to a county of our size to really help us stay connected and really aware of all the complexities and the challenges that we face on the county level. So NACO being such an important aspect of our county government, when this initiative came out in May of 2015, we immediately got on board with the passing of the Stepping Up resolution. So our perspective was a little bit more of the top-down, where our leaders were committed and really wanted us to start focusing on this collectively with our Criminal Justice Collaborating Council. So our CJCC, as we call it, really was the home for our Stepping Up initiative. So we created a work group chaired by our Human Service Director. So she chairs the committee. We also have our sheriff, jail staff. We have our human services, behavioral health staff, crisis workers. We have an integrated treatment specialist that really works collaboratively between the court system, the jail system, and our human services. And then as we have grown, we've incorporated our partners out in the community. So we have our homeless shelter partners, domestic abuse shelter partners, and we also have the peer respite partners, as well as people that have that lived experience with mental health and experience with the criminal justice system. So we have an active work group that for the last 2 years, you mentioned the 2-year anniversary, so we've been at this for some time. We really started by forming that team and participating in all the resources that NACO provides. So the toolkit for Stepping Up, I'd really encourage every participant to take a look at that toolkit. We collectively sat down together and watched those webinars live when they were coming out. They're audio archived, which is great, so all that information is still there. And that helped us all kind of get the same foundational understanding and really learn all the different aspects to the Stepping Up initiative. So that's how we got started with that. The team itself really has been active, and we meet monthly. It's the policy team that feeds into our CJCC has an executive committee that is led by 5 of the members, and then we also have our full council that gets together every other month. So Stepping Up has some of the same players. The sheriff is a member of our executive committee, as well as the Stepping Up initiative. Likewise, our human service director is as well. Our county board chair at the time was our CJCC chair, so that worked well in really providing us the continuity and leadership and taking a look at Stepping Up. To be honest, when we got started with this, we thought we were in pretty good shape here in Dunn County. We have a lot of things in place. We have a treatment court, which is the drug court model. We have a crisis call center. We have mobile crisis that is available. We have our integrated treatment specialist that's working collaboratively across systems. And we have jail services as well. There's medical and mental health services that are provided in our local jail. So at first we thought, you know, this Stepping Up sounds interesting. We always want to improve our systems. We do consider ourselves very open-minded, and when we're looking at our challenges, recidivism is one of our leading challenges that we have here. We so often see the same folks come through our doors, our many doors that we have, but we do see some of the same folks that have those persistent challenges that they're facing. So what we did, we started to take a look at our, to see if we have a problem. Are we kind of seeing the same challenges that are out there across the country? And we did. We found in our point-in-time analysis, very rudimentary. We don't have sophisticated systems. We don't have ample amounts of staff to really dig deep. It's mostly the same folks that attend the Stepping Up work group are the ones doing the work. And we really did find that we did have a higher rate of prevalence for people with mental illness, significant mental illness in our jail. And we really did some cross-referencing and took a look at indicators and diagnosis. So we found that about 14% of our individuals, in a point-in-time analysis done on 3 different occasions, had significant mental illness in our jail. When we cross-referenced with our substance abuse treatment provider, we found that nearly 28% recently had received services. So we did see that we had a higher prevalence of mental illness and substance use disorders. When we took a look at our length of stay for people with those people with significant mental illness, we found that they stayed 50% longer in our jail. So we did see that, although this isn't a sophisticated analysis, we did see that, yes, we are facing the same challenges that we're hearing across the country, and it really reiterated what we learned with the Stepping Up initiative. So what we're trying to do here in Dunn County is dig deep and really rely on a lot of the resources and expertise and technical assistance that is being provided for the Stepping Up initiative and the participating counties. That's one of the most important things that we receive as being part of the Stepping Up. So often folks really have to go it alone or try to figure it out themselves, but this initiative really provides so many resources to help connect the dots and help each local unit where the rubber hits the road, as we heard before, really figure out how it's going to work best for their community. So I'm just really pleased to be part of the initiative, and we're looking forward to continuing to learn and grow and improve our systems and improve the outcomes for the people that we work with day in, day out.
Great. Thank you so much, Sarah, and thank you to all of you for your comments and for the really important work that you're doing. I know it's beneficial for folks on the phone to hear what's happening in other counties. So I appreciate everybody and your quick presentation. So what I want to do now is sort of have a discussion and do some Q&A with the presenters. So if folks want to start, I know some people have already started sending in some questions for the 3 presenters. And I think we'd really like to focus in on this question of committed leadership and how you get folks to pass a resolution and how you get your leadership involved. So maybe I'll kick it off as questions continue to pour in, and I'll ask sort of all 3 of you. Sarah, maybe we'll start with you because you just spoke. Can you talk a little bit about what strategies you've used to identify champions in your community, and sort of any tips that you have for other counties, especially small counties, on how to get them to pass a resolution?
Thank you. Well, I would encourage everyone to really get to know their supervisors, their county board members, to attend county board meetings, to get them involved in their criminal justice collaborating councils if they have them. We have our county board chair and our judiciary and public safety committee chair are permanent members of our CJCC. So we're able to get that buy-in. We're able to help connect those dots for the county board members that sometimes are looking at they're looking through a fiscal lens, I would say, to start off with. So to get that buy-in is really important. To get to know them, so it's if you're able to speak with people, formally or informally about your initiative, what you're working on, what challenges they see. It starts to build that dialogue, and it allows people to feel more comfortable in communicating if they have an interest or a personal connection. There's still a lot of stigma associated with mental illness, mental health, substance use disorders. So there's a lot of people with those lived experiences or of the relatives or friends and family, but they're just not feeling the environment is conducive to really kind of sharing some of that. So, it's building those relationships, it's understanding, who you're working with, and you'll start to see who those champions, they start to emerge, just like leaders do. You start to see who's more interested, who's more passionate, who really wants to make a difference. And that can start to bring along some of those others that might be just unaware or doubtful or reluctant to change in general.
Great, yeah, definitely. Thank you. Commissioner Brooks, I was wondering, you obviously are a big champion of this in your community, but we also know that not everybody in Tarrant County can be the champion on this. Can you talk a little bit about how you work with different stakeholders in your county? They have, each is going to have different priorities and different agendas and what they want to do with this. Can you talk a little bit about how you bring those folks together towards a common goal, and how you figure out, how you have figured out kind of what that goal is, and how you work with folks to move towards that?
Sure, Nastasia, and thank you for the question. I think that most people with whom you talk about this issue will agree that the county jail is not the best place for someone to regain his or her mental health. They will also be kind of routinely appalled once it's pointed out to them that the county jail is, in many counties, the largest provider of mental health services in the county. But what I've found is that once you acquaint people with those facts, they just kind of stare at you with a dumbfounded look, and they don't know where to go with that information or what to do about it. That's why our Criminal Justice Coordinating Council was so effective in providing leadership on this issue, because it is so broad-based and because it is representative of the major institutions in our community that touch not only mental health, but touch criminal justice. I'm from Texas, and sometimes even though people may agree with you philosophically about the warm and fuzzy argument, they're more convinced by the economic argument. You have to show them how much it's costing them to maintain such a large population of mentally ill persons in their jail, and how much money they can save by doing it a more effective and more compassionate way. Those are the strategies we've used.
Hey, this is Will. If I could just piggyback off of those two comments quickly, is that okay?
Yes, please. Yep.
Excellent. Yeah, just not working in a county myself, but working with a number of counties across the country. I just heard a couple pieces there from what Ms. Benedict and Commissioner Brooks had to say that we hear a lot from a number of counties across the country. So just that first point about the champions, I would say, at least from my experience, 9 times out of 10 when we're working with counties, they tend to know who those champions are and who those, maybe champion's not the right word, but basically they could say, if we can get these 1 or 2 people on board with this initiative, a lot of other folks would fall into place. And as Sarah was saying, it's a lot about that relationship building with those different individuals and those stakeholders from there that really can make or break the work that's going on around this initiative. So that's maybe that's a good answer to hear, maybe not, in that for the most part folks know the people that would have the influence that they would want to bring to the table there in the jurisdiction, at least from what I'm seeing, but building those relationships and figuring out a sustainable process of involving them enough that it's useful to have the buy-in from such an influential person, but not weighing them down with a meeting every other week on the same issue, and knowing how to report that information back up to them in a useful way is the devil in the details sometimes there with that piece. And then just the second piece that Commissioner Brooks was talking about the important role of a coordinating council. That's just something we hear time and time again, especially from jurisdictions that through the grants that we work on are setting them up for the first time. And it can be a very lengthy process to develop those coordinating councils, but once they're together, especially when you're having behavioral health agencies and criminal justice agencies in the same room, I just keep hearing basically having them in the same room in those discussions can just quickly result in some pretty fast changes and just a level of response to policy and programmatic changes that you don't that just had never been discussed before in jurisdictions. So it's been pretty encouraging to me to hear that once folks get into the same room with these regular planning groups, they can really move pretty quickly on addressing some of the low-hanging fruit that's out there in the jurisdiction. And then, yeah, I mean, time and time again, we just hear about the usefulness of collecting data and qualitative analysis that can guide these processes as well for knowing what to do to address this. So that would be my 2 cents there.
Great, thanks, Will. I want to have just sort of a follow-up to this. One of the questions we got is, did engagement with Stepping Up require significant staff additions? And I know, Commissioner Brooks, you already have a CJCC, and Sarah, you are the CJCC coordinator. So maybe you can talk a little bit about, Sarah, maybe you talk a little bit about your role and the importance of having this role. And then, we also know that it can be tough for a county to hire and staff someone who sort of fills this role. And so maybe talk a little bit about how that works in your county and how they were able to fund you and sort of what you think you bring to the table on these discussions.
Thank you for the question. It was difficult. My position actually started in 2008, and it was an evolutionary process. It started with the formation of our drug court. So there was funding that was established, grant funding, that really, we started a joint criminal justice coordinator / drug court coordinator. As the drug court grew legs and matured, we were able to sustain a full-time coordinator for that position, and that, again, is evolutionary. It literally took years to grow and develop and see the value. So my position has been full-time for a number of years. So when we were able to participate with the Stepping Up resolution getting passed and getting our work group started, we didn't need to hire any additional staff. Luckily, we have a local university, so as we're collecting data and trying to learn more about how we're working and how our changes are affecting our system, we're able to tap into some of the intern or free labor that local universities can provide. So I'd encourage anybody that has a local university or a technical college. There's a lot of students that are really looking for that practical experience, and it can be really beneficial as well if you're able to establish it in a constructive project. So often, right, it comes back to that criminal justice coordinator, and it's becoming more and more important to have that, the council. So many of the grant opportunities that are out there really are looking for that set of stakeholders that are already established. So CJCC really provides a springboard for so many more opportunities for change and for really bringing in that expertise and funding for different initiatives such as Stepping Up.
Great, thanks, Sarah. I don't know, Commissioner Brooks or Will, did you have anything to add to that in terms of, sort of the staffing capacity and what bringing a staff member really brings to your effort?
Well, you have to have somebody who's in charge. Our experience was much like Sarah's. We had on staff in our county administrator's office a criminal justice manager whose job before Stepping Up, before the establishment of the CJCC, was to seek out and apply for grants for our various criminal justice programs, including our 8 to 10 diversion courts. During the process of doing all of this, he became quite an expert on criminal justice programs, and he was the most appropriate person to be repurposed to staff this particular effort. So I would advise y'all to look around and see who's on your staff that you can use at least in the interim until the program gets up and running and you have savings generated so that you can go the justice reinvestment route and have one particular person in charge.
Thank you. Really quick, like two-word answer from Commissioner Brooks and then from Sarah is who pays or who is the oversight for this position? Is it the court or is it the county commission? Who is sort of the oversight of this person in this position in your county? Commissioner Brooks.
County commission. Our county administrator reports to our commissioner's court.
Okay, great.
For Dunn County?
Yes.
It would be the county manager who reports directly to the county board.
Okay, great. There was a question that came in. I just thought we could answer a little quickly. So we had another question come in that I thought was really interesting about public engagement and support or opposition for your efforts. And maybe Commissioner Brooks, maybe you start on here and talk a little bit about how you guys have engaged with the public on this or other related issues, and any strategies or tips you have for talking about this issue with the public.
We have found that when you reach out to the public, most of our constituents either have someone in their families or know someone who has been touched by the issue of mental illness. And I've found that the general public is a lot more sensitive to these issues than are some of our policymakers. So it's kind of easy whenever we need to gin up a crowd to support a particular initiative or program that we want to implement in this arena. It's pretty easy to get folk to come down and testify for it and show the appropriate public political support so that we can then do what we know is right.
Mm-hmm. Great. And Will or Sarah, have you either Will seen this in other communities who have done a lot of community engagement on this piece, or Sarah, I don't know if you guys have worked with sharing some information about what you're doing with the public?
So this is Sarah, and our meetings are open to the public, and our agendas are posted to the public. We encourage participation. We try to educate our community and different organizations that our county is part of on what the Stepping Up initiative is. And we have to do a little bit of explaining. We have to, Stepping Up isn't self-explanatory. So we explain it a little bit, but there's been a lot of public support and no pushback at all. And I would echo what Commissioner Brooks expressed, just with that personal connection. So many people know somebody or are familiar, so there's support out there. I wish we had more media opportunities in our community, where we have limited newspaper, regional types of news. But so often our local community doesn't always know what's going on right here in Dunn County. So it's one of our county board directional initiatives to really have a more engaged community and to really focus on how we're communicating with the public and how we can take their feedback and participation and have them work with us towards different outcomes that we're looking for.
Great. Will, any thoughts on this one?
Yeah, I would just add to that we have seen a number of jurisdictions work on op-eds themselves to highlight the work that they're doing with that planning process, and several of them have used the 6-question document as sort of the foundation for how they've framed those op-eds. But I'm thinking of a couple of jurisdictions in particular that have really used that op-ed to try to gather more engagement from the community stakeholders. So they've been open to the public as well, but they have been looking for increased engagement. One jurisdiction actually ran some focus groups with community partners, and then also with people, this is a little different than what you're talking about, but people that were either mental health clients, but also in the jail as well, and trying to make sure that they're representing their interests appropriately. And then just the other pieces we've seen with the planning committee, some jurisdictions really work pretty closely with some different advocacy organizations. I know one jurisdiction is working with, yes.
Will, I'm sorry to interrupt you, but we're having a really hard time understanding you. So I have to cut you off. We're getting a lot of really weird feedback, and I'm sorry I have to cut you off on that.
Sorry.
That's okay. If you could maybe mute your microphone or something, it's making some feedback there. So great. So this is really great. I want to thank all of you on the phone for all of your questions. I think this is a great discussion, and thank you for presenting and speaking with us. Before we go, I want to do my favorite thing, which is just a couple more poll questions, because I really want to make sure that what we're doing with these network calls is something that is useful to you, and that we're being responsive to the things that you are interested in hearing about and speakers that you are interested in hearing from. So why don't we launch the next poll, which is focused on who you want to hear from. Okay, great. Why don't we show those results? So it looks like we want to hear sort of more of the same. So we want to hear from our national experts and academics, sort of like Will here on the phone, and we want to hear from our county folks as well. So folks like Sarah and Commissioner Brooks. So this is great, and we'll continue to make sure that we're highlighting the great work that's happening in counties and talk about the latest resources that are out there. All right, let's do that one last poll, please. Okay, all right, let's see what the results say on this one. Okay, so it looks like most of you, you know, want to do it maybe shortly after. So last time we did it, you know, a month after the webinar. Maybe we could do it a little bit closer so it's a little bit more fresh in your mind on what we're doing there. But folks, it sounds like really want to continue to have these calls. So thank you very much, everyone. And please remember that we're going to be doing an evaluation will pop up at the end of this call, and we'll also email it to you. We'd love to get more feedback, and we'd love to hear some ideas of folks that you would love to have presenting or topics that you want to cover on these network calls so that we can continue to shape them into what you want. So as I mentioned, I just want to close and say, you know, we have the webinar next month on April 6th at 2 o'clock. Please go ahead and register, naco.org/webinars. And again, look out for those small network calls. You should get another email from us probably in the next day or so if you've passed a resolution. And don't forget to go to the Stepping Up website, stepuptogether.org. Check out the toolkit and the resources that are available there. We have a lot of archived webinars that Sarah was talking about that you can download and watch those and share them with your team. And we're going to continue to host these monthly webinars and calls to help move you guys forward. So please keep an eye out for all of the emails. Make sure you're signed up for the listserv that you can sign up at stepuptogether.org or email us at info@stepuptogether.org. And then this is, as promised, the contact information for me. I'm the one at the top, Shanice Bonilla from the Council of State Governments Justice Center, and Lindsay Fox, who is with the American Psychiatric Association Foundation. Please feel free to reach out to any of us if you have any questions or have any ideas, and we would love to hear from you always. So thank you all for participating, and I hope you all have a wonderful day.